Welcome to our 5 on 5. We're pleased to be joined by Augustine Colebrook, the director of the Trillium Waterbirth Center and a nationally certified state licensed midwife. Augustine, thank you for coming in. Appreciate it.
Thanks so much for having us.
All right, so tell us tell us about midwives. What do they do?
You know, midwives, modern midwifery, which is really different than maybe a picture in ancient midwifery, but modern midwifery is a blending of art and science. The traditional with woman experience with modern cutting-edge evidence-based care. We provide full-service maternity care in the home and in our state licensed facility.
Yeah, tell us about Trillium Waterbirth Center. How is that different from other birth centers?
Well, Trillium Waterbirth Center is a freestanding birthing center, which means that it's not connected to a hospital. And it's also run by midwives. So instead of policies or procedures that are implemented in a hospital set by doctors, this is a facility directed by midwives. And so the midwifery model of care is oftentimes much more naturally focused, much more compassionate and one-on-one focused. So the woman gets a lot more individualized care. For instance, prenatals last an hour, which is really different than the obstetrical model.
Yeah, okay, all right. Now tell us, is there a licensing program for midwives? How does that work?
Absolutely. There's a nationally certifying program through the North American Registry of Midwives, which I have completed. And then there's also state licensing, and that's a easy to find online program, but it's not easy to complete.
Okay.
It takes many years. Most of my students are with me from 3 to 7 years.
Wow. Okay. All right. Now, recently the state started reorganizing the Oregon healthcare system. Of course, something we've been talking about, coordinated care organizations along those lines. How is this affecting you guys?
Well, it's interesting. We're really excited about the coordinated care organizations where we have a home for our health care. One caseworker manages your health care needs through the Medicaid system. And it sounds like we would be the perfect candidate for that type of care. In our office, aside from our midwives, we also have nurse practitioners and chiropractors, acupuncture, massage therapists, people who can provide holistic care for the whole family. And yet we're being excluded. As we understand it, January 1st, 2013, there will no longer be a fee-for-service program, oftentimes called the open card. OHP has taken that away from families. And that previously was their only way to access licensed midwifery care and out-of-hospital birth. And so with this transition to CCOs, midwives and birth centers are now dependent upon speaking to the CCOs directly in order to become credentialed through their CCO. And so far, we're not having any luck.
Okay. All right. Well, that's fascinating. We're going to take a quick break. I know you have a petition going and gathered a lot of signatures. We'll start with that after a quick break. Stay with us. We'll be right back. Welcome back to our 5 on 5. We're here with Augustine Colebrook. We're talking about midwives here in Southern Oregon. You recently started a signature campaign. How many signatures were you able to get?
We've received over 1,000 signatures for this petition asking that CCOs include midwives and out-of-hospital care in their policies and in their reimbursement schedules.
Okay, and CCOs, of course, coordinated care organizations. Now, is this law or is it policy? Where do we stand with this?
Well, it's definitely law that they're no longer including the fee-for-service program, which used to reimburse midwives. What's interesting is that reimbursing licensed providers that practice inside licensed birth centers is actually a federal mandate, and it was in the language around the Affordable Care Act of 2010. And by not including and paying licensed providers inside licensed birth centers, they're actually violating a federal mandate. In addition to that, the law that passed in Oregon around the CCO restructuring of Medicaid says that the CCOs are not allowed to exclude any licensed provider in the state. So by blanketly refusing to let in any midwives or birth centers, they're actually in violation of state law too. So I have no doubt that we'll have a switch in this situation. I have no doubt that the CCOs will come to understand that midwives not only save them money, but also provide better outcomes. Moms and papas are usually much happier when they get that one-on-one midwifery care instead of being moved through a system. So I have no doubt that we're going to see that change. It's just a matter of when. And that's what our current push is about, is making sure there isn't a gap in care. Right now we have clients through December 31st, and January 1st it all changes. Okay,
yeah, and now when we talk about CCOs, is this only OHP clients? How does that work?
It is. We're talking about CCOs, coordinated care organizations, which is the new way that OHP is running what used to be managed care organizations.
Okay, and let's see, what percentage of your clients, I guess I should ask, are on OHP?
About 25%.
25%. Okay.
But in this county, I think it's higher than that. I think we could accept many more if we were included.
Okay, all right. And forgive me, after the delivery of the signatures today, what do you hope to see as the next step, and what will be the next step?
Well, we've requested a meeting with the decision maker, essentially, at All Care, our local regional CCO, and we're hoping that that will be productive. Right now, All Care's official position to us is that they don't recognize out-of-hospital birth. Again, that's in violation of the federal mandate and the state law. So I think we'll be able to change their mind. It's just a matter of when and how.
Okay. All right. And if anybody has any more questions, you have a blog set up on your website?
We do. You can read lots of information, especially about this situation, at wisewomencare.com and look for the blog link at the top.
Augustine, great to meet you. Thank you so much for coming in.
I appreciate it. Thanks.
Okay, thank you. Stay with us. We'll be right back. Welcome to our 5 on 5. We're pleased to be joined by Augustine Colebrook, the director of the Trillium Waterbirth Center and a nationally certified state licensed midwife. Augustine, thank you for coming in. Appreciate it.
Thanks so much for having us.
All right, so tell us tell us about midwives. What do they do?
You know, midwives, modern midwifery, which is really different than maybe a picture in ancient midwifery, but modern midwifery is a blending of art and science. The traditional with woman experience with modern cutting-edge evidence-based care. We provide full-service maternity care in the home and in our state licensed facility.
Yeah, tell us about Trillium Waterbirth Center. How is that different from other birth centers?
Well, Trillium Waterbirth Center is a freestanding birthing center, which means that it's not connected to a hospital. And it's also run by midwives. So instead of policies or procedures that are implemented in a hospital set by doctors, this is a facility directed by midwives. And so the midwifery model of care is oftentimes much more naturally focused, much more compassionate and one-on-one focused. So the woman gets a lot more individualized care.